Well,
But
I can relate
Cynthia,
to that.
welcome to Life on the Level. And just for the members to know this little bit of history, when the sport group was looking to be founded some 5 years ago, we deliberately looked at the VIDA guidelines for starting a sport group and are proud to be affiliated with VIDA and follow all the best practice about how to run a support group. So VIDA was with us from the very, very start. So it's a great honour and privilege, Cynthia, to welcome you here. And it's over to you, please, to tell us all about VIDA and its relevance to British balance sufferers. Thank you very much.
Thanks, Kevin. And thank you, everyone. Thanks for having me here. As Kevin so generously introduced me, I'm Cynthia Ryan. I'm the Executive Director of the Vestibular Disorders Association here in the US. We're based in Portland, Oregon, so I can relate to your weather woes. It is raining here today. And as we say in Portland, if you don't like the weather, wait a minute and it'll change. So, so I've been, I'm gonna start with just a little personal introduction, and then I do have a presentation because you know that's the way you get information across. But I really want this to be more of a, more of a conversation. I don't want to be pushing information at you. I want to be sharing information with you. So I've been with VITA for 12 years, and my personal connection is through my mother, who has Meniere's disease, vestibular migraine, and BPPV. And so I grew up with my mom experiencing these, as you know, unexpected and tumultuous vertigo episodes. I remember when I was gosh, I guess I was 14, and my mom in the middle of the night had a big vertigo episode, and we called the emergency line, and all of a sudden there were a half a dozen emergency personnel in my mother's bedroom, and it was really dramatic. And again, the day after my wedding, my mom, big stress event went into an attack. So I definitely can relate to what you all go through every day. And interestingly, when I first started with VITA, and I was talking with vestibular patients, I'm like, oh wow, this is my mom's story over and over again. I mean, growing up, it was just part of growing up. That was my mom. That's who she was. But to hear that this wasn't just my mom, this was something that so many people experience, and really the same story of being misdiagnosed, of not being understood. And I think back to that with my mom, so many times when she's like, oh no, we want to go out and do this thing. And she's like, no, I don't feel like I can do that today. And it really brought it home for me. And so it's a passion of mine to be able to educate other people about that experience, because it's real, and it really is difficult to understand if you haven't been through it. So I'll go ahead and boop, boop, boop. I'm gonna share my screen and then switch to, so you're gonna see yourselves, and then switch to view my slideshow. Can everybody see that fine?
Yeah, that's really good, Cynthia. Really good.
Okay, okay, great. So uh, I think one of the things that this just introductory slide says to me is that we really are a global community. VITA started out here in Portland, Oregon, in the US. And we started out actually as a support group. The humble beginnings of a support group. There were patients of one of the vestibular specialists here, world-known vestibular specialist here in Portland, Oregon, named Dr. F. Owen Black. And they all, like you guys, felt isolated and alone. And Dr. Black said, you guys should get together. And they're like, wow, I'm not alone. There are other people who experience this. We need to do something about it. We need to we need to raise awareness of these conditions. They started, the first thing that this support group, besides supporting each other, started to do is recognizing the need for scientifically validated information about these conditions, because this was before the internet, So how are you going to learn about what is a vestibular disorder? What is Meniere's disease? What are the tests? What can I expect when I go to see an audiologist? How are you going to learn about all of these things when there's no, validated source of information? So that was the first thing they started doing, and in doing that, they partnered with they built a medical advisory committee, medical and scientific advisory committee, and that's where the basis of our patient education articles comes from, which I'm going to talk more about. So that was really the core of, and always has been the core of what VITA is educating patients about what's going on with them. Also, from the beginning, promoting awareness of vestibular disorders. I mean, that the word vestibular is like, blah, 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 it's a complicated word, and who knew that vestibular meant inner ear, and who knew that inner ear meant balance and dizziness. So yeah, actually, in the beginning, when back in 1983, when the support group started, and the nonprofit was formed in 1984. It was called the Dizziness and Balance Disorders Association, and they made the conscious decision to change the name to Vestibular Disorders Association in order to raise awareness about that term. And I think it's still a struggle. My vision is that, in hopefully less than 10 years, but, hopefully soon, when people think of it's like I equate it to a condition like celiac. 10 years ago, nobody knew what celiac disease was. It was this weird thing, weird term, and now everybody thinks celiac equals gluten-free. They get that. So, my vision is that we'll do something similar with vestibular, that eventually people will hear vestibular and they'll think dizzy, they'll think balance, they'll get that it's a condition of the inner ear. So that's something that we really work on every day through our awareness campaigns, but especially during Balance Awareness Week, which is in September. And it's a global event. The idea is to just spread awareness by sharing this common message that vestibular disorders are real and they're impactful, and how they are impactful. We can talk more about that later too. Other things that we do, which we'll talk more about, since I've been with VITA, we've been getting more involved in advocating for improvements in vestibular healthcare and research. Talk more about that. Partnering with medical experts, such as academic researchers, such as companies who are developing either biopharmaceutical treatments for vestibular disorders or medical devices to test or treat vestibular disorders. We've been around for a long time, and we are not going anywhere. And something that I think that you guys, that a lot of people don't know, is that we're still really small. We're not this big organization in corporate offices. We have a small office in a basement, and there are 6 of us. So we're a grassroots organization, and we're doing what we can to raise awareness about vestibular disorders and support you guys. Our mission is always focused on the patient, supporting and empowering patients. And we partner with healthcare professionals to do that, because the healthcare professionals who are working with you are a key part of your recovery, but it's all really about the patient, and our vision is to make vestibular disorders widely recognized, and so that you guys get diagnosed quickly. Quick overview of our programs. We're going to talk more about them. I talked about our patient education, and that's the key to getting people on the road to recovery. I want to talk a little bit about what that looks like. You know, picture when you were first experiencing your symptoms and you didn't know what was going on. You know, where did you go for information? You probably went to the internet. So we focus on having all sorts of patient education materials available to people to explain what is a vestibular disorder, what is the diagnostic process, what are the symptoms, how do you get diagnosed, you know, what is the diagnostic process, and what do you need to do to get better? And that's both from a medical standpoint, you know, you need to go through this process to get diagnosed, but you also need to be thinking about, you know, what is outside the medical system that is going to support your wellness, because the medical system isn't always going to serve your needs. So you know, we offer information about complementary and alternative treatments, and also just sharing patient stories, which we'll talk more about as well. Supports. You know, we started as a support group, and we promote the growth of support groups across the world. We have, as Kevin was explaining, we have um, like organizational systems to help people like Kevin get a support group going, and both in person and online. Before COVID, we were doing online support groups because so many vestibular patients can't get out of their home, and there just aren't enough in-person support groups for people to for there to be a support group for everyone. And I think that it's just what's beautiful is I've heard so many people say that when they became a part of a support group, they felt like they had a family that they didn't have before. Because so many people's families don't understand what they're going through. Their friends, you know, don't call them anymore. Um, we have we have some general support groups like this one, and we have more specific support groups, like a support group specifically for Meniere's disease or mal de débarquement, or we have a support group for people who have been medically retired because of their condition. And we have a couple of new support groups coming out, one for people who have hearing loss, one for people who are runners before they became a vestibular patient, and that's an important part of their life. They want to continue doing that. How can they do that while they're, you know, with the struggle of having a vestibular disorder? And we also have some in other languages like Spanish. Um, Advocacy. I'm going to talk more about that in some of the other slides, so I won't say much about that. And then connection. Really, that's the core is connecting patients with healthcare professionals, and then support networks. That's the progression that I see when someone comes to us for help. The first thing that we do is the education part. Let's help you figure out what's going on. Then we want to connect you with medical specialists. And I know that that's different in different countries. You know, the medical system in the US is different than what you have in the UK with the NIH and then private insurance. But still, finding those healthcare professionals who can diagnose you, that is really the key, finding the right healthcare professionals. And then once you get past that diagnostic process, becoming part of a support community is so important. This slide just kind of gives you an idea of the community that we have, and it really is a global community. It's, you know, I know that you guys, how many people are on the call today here? About 40 people. You are part of a much larger community. Um, uh, our social media following is a great place to just get connected, so that, you know, when you've got your meetings, what is it, Kevin, every other month? And then in
Yeah, we
between,
do 6 meetings a year, so once every 8 weeks.
perfect. In between, you want to be able to connect with vestibular patients And there are lots of ways to do that through our social media channels. Excuse me. We also do support people one-on-one. We have a staff person called our community resource coordinator. So if you have questions, you can just email us and she will help one-on-one. She will help you get to the information that you need, whether it's information about a particular condition, whether it's a healthcare professional, or whether it's getting connected with someone who's been through what you've been through. You know, I had one woman who needed to, she was advised that she should get a cochlear implant. And she's like, you know, I don't know how that's going to affect my balance. And I'm like, okay, let's connect you with someone else who has been through that. And they can share with you what the experience was. That's what we're about, is helping people both, you know, globally and one-on-one get connected to the right resources, get connected to people who understand what they've been going through. So I'm going to share with you some of our outreach programs that I think are really useful, and one of them is our live events. So live events, you may be familiar with the Facebook live events, where you can you know, have a presenter. It's kind of like a webinar, except you can be asking questions of the presenters. We do these to bring you access to healthcare experts around the world. And I really do mean around the world. We've had some amazing guests, amazing speakers. And recently we did one with Dr. Peter Ray, or Professor Peter Ray, who I know you are all familiar with, being interviewed with VITA's, the chair of VITA's Medical and Scientific Advisory Committee board, Dr. Joel Goebel. And it was really fun because Dr. Goebel and Professor Ray are colleagues from a long way back. Dr. Goebel often comes to the UK to speak. He stays with Professor Ray, they're buddies. And so we had a really interesting discussion of the difference between, and you know, they're experts in their field and in their medical system. So it was a really interesting discussion of how is care for vestibular patients different in the US versus the UK. One of the things that I brought away from that is that the vestibular patient experience and the needs of the vestibular patient is the same no matter where you are. And yes, there are some differences in how you make it through the system, but what we need to be doing to provide for vestibular patients is the same, and something we can all be working together toward. So you can always find our previous episodes both on Facebook and on YouTube. They're streamed to YouTube as well. We've got which, you know, and I don't know if I talk about this in the presentation, so I'll just mention it here. We have visit our YouTube channel for videos that of all sorts. We have our webinars, we have short videos, short educational videos, we have patient stories, and we'll talk more about those later on. We have, you might be familiar with, this year was our 4th annual virtual conference called Life Rebalanced Live. It's in March. It's 5 days of speakers and patient panels. So each day has an interview with an expert healthcare professional, followed by a patient panel on the same topic. And I love that combination of presenting information, because it really is so important to present, you know, to present the expert opinion. Here's here's this year's agenda. We had a speaker talking about central vestibular disorders, to present, this is, this is the information that is scientifically validated. And then this is the patient experience on that topic. This is what it means to be a patient suffering from triple PD or vestibular migraine. And to bring those perspectives together, I think is really powerful. And something that the virtual conference it happens on this platform where you can come and during the whole week, you can be interacting with people who are participating in the conference. And we have a lot of community built during that time. A lot of support groups actually come out of the conference because I remember this year I saw so many people typing into the comments, how can we stay connected? Because people just when they're coming together to learn and to share their story and to experience this community activity, it just feels so empowering that they want it to continue. So I highly encourage you we've got recordings of these. You can always check in with us and watch last year's and stay tuned for next year's virtual conference. Our patient registry, this is one of the ways that we are advocating for vestibular awareness is by collecting information, patient-reported information about the vestibular experience. So it's like a database of your medical data. It's de-identified, but this patient-reported information is so important to be able to collect it in a scientific way that we can bring this information back to the scientific community so that it can be used to determine to evaluate what are the trends, what is happening in vestibular care. So for example, one of the things that we've seen, we started our patient registry initially back in 2014, and one of the things that we've seen is a decrease in the time it takes for vestibular disorders to get diagnosed. That's what we're looking for. We're looking for trends in symptom clusters, in who is it that people, what kind of vestibular professionals are people seeing in order to get diagnosed? How long is it taking? What are the barriers to diagnosis? Is it that you can't get to a healthcare professional because you can't travel? Is it because there's no one, there isn't a healthcare professional near you? Is it because of wait times? And it took too long to get to a healthcare professional, and now, the damage is done. What are the problems in getting a diagnosis, and what are the treatments that are actually making a difference? So doing this in a scientific way makes, collecting the information in a scientific way is important, because then we can take that data and report on it in scientific journals. Once information is in a scientific journal, then it is considered validated by the scientific community, and it can be used to advocate for changes in the medical system. So this is one of the ways that we're really looking to make changes to, and it's a long road. Research, as you know, is it takes a long time, but we need this data in order to show that this is what is happening. This is the vestibular patient experience in terms of your medical data. Kind of a long story short, we're in the process of moving our registry to a new platform, so stay tuned when we have that up and ready. We're going to encourage people to participate in it. As I talked about before, we are definitely, we're not just a US-based organization. This, I mentioned here ADEV, which is our French partner, because it's a great example of the types of chapters that we can build around the world. So there was a French, a patient in France who said, I need, he recognized that he was fortunate to also speak English, And so he could benefit from the information on Vita's website. His name's Yanis. But he said, not everyone in my country, or not everyone who speaks French, is that fortunate. I want to make a difference. Um, I want to help other people get access to this information. And so we worked together to translate Vita's top articles into French and create a French landing page on our website. So we've also done this in Spanish. We have some articles in Czech. We're really looking to partner, and this is grassroots. We're not we're not big enough to go to the UK and create a chapter, or to go to France and create a chapter. We rely on volunteers in other countries, like the UK, like France, like Australia, like Canada, to help us with, feet on the ground, with community connections. Even here in the US, that's how, the US is a large country, and we can't be in every state. We rely on our volunteers to take information and share it with people in their communities. And that's how we work together to raise awareness. And it's not about, everybody, you come to Vita because we're so great. It's about, come to this community where where we can support you in your journey, and we can share the information that we've learned about how vestibular disorders are diagnosed, treated, and coping strategies, all of those things. And our Life for Balance Chronicles docuseries is one way that we do that. So a couple of years ago, we started this project with Kimberly Warner, who some of you may be familiar with. She's a vestibular patient. She actually happens to live here in Portland, Oregon also. But that was kind of, we've discovered that later. Oh, wow, you live right around the corner.
Cynthia, she not only gave a presentation to us 2 years ago, but she's a member of the support group. So we know Kimberly. Her work's brilliant. Sorry about that.
Oh, yes. Well, I love Kimberly. And actually, Kimberly and I also, and I don't know if I have that in this presentation, we are now we co-host a podcast called I See You. It's I See You, but it means I see you, where we interview a vestibular healthcare professional and a patient at the same time, because we want to have those conversations between patients and healthcare professionals. So if you know Kimberly, you know that she is not only an incredibly empathetic person, and she's also a film producer. And so we employed her to help us share the vestibular patient experience through this docu-series that we call the Life Rebalanced Chronicles. And we had we have 3 seasons of these, where basically it's just patients telling their story. And it's unscripted, it's raw, it's beautifully produced, because Kimberly just does a wonderful job. And so it's really, the stories come through really powerfully. I tell you, every episode I end up crying at some point, because it's just so the stories are just so impactful. And what we're trying to do with this, besides, I think for patients, this is a way to hear someone else's story and see your own in it. And in that way to know that you're not alone. What we're also trying to do with this is we're developing what's called a narrative medicine curriculum for healthcare professionals. The idea is to use patients' stories to educate healthcare professionals about the vestibular patient experience. I mean, I'm sure you've said before, I just wish that my I wish my doctor or my physical therapist understood what I was going through. And that's what we're trying to do is to share that through patient stories. So, but it's difficult to get into the medical curriculum. Narrative medicine is a relatively new area. Narrative meaning through a narrative, through a story. And what we're doing right now is some of the medical providers on our team are doing research on narrative medicine and empathy. Empathy is actually it's a well, I think we all know what empathy is. It's being able to feel what another person is feeling, and it's something that they are recognizing is an important quality to healthcare professionals, and so they're looking to include empathy training in the medical curriculum. So we're kind of leveraging that, and we'll be developing sort of guidelines on okay, let's do we'll test these healthcare professionals before before we have them watch the Life for Balance Chronicles. Then we have them watch the Life for Balance Chronicles, and then we test them again and see if their empathy for this patient population changes. Do they have more empathy? And then the idea is to develop what we call an empathy badge, something that they can say, I've been through this training and I have, used this to develop more empathy for vestibular patients. And we're really excited about that. Another thing that we have been doing is our medical advisors created what we call Balance Centers of Excellence guidelines. And I know that here in the US, one of the problems, and I'd love to hear from you guys how it is different in the UK, but one of the problems is access to vestibular healthcare professionals. Oftentimes you might get an ENT, for example, who's not a vestibular healthcare professional, or a physical therapist who that's not their specialty. And so but also you might not get a team who is working together, because that's the key. Is it's not just about getting a diagnosis. It's a multidisciplinary problem. You need to have an entire team of vestibular healthcare professionals supporting you. You need to have the ENT or neurotologist, or I know in the UK you have audiovestibular physicians. You need to have a physical therapist. You need to have an audiologist. You may need having a psychologist on the team, but having that whole team and all the team members doing what they're specialized to do and working together. And we're trying to promote that by defining what a multidisciplinary team is, and what clinics that focus on vestibular disorders, what their qualifications are. What does a clinic need to be a vestibular clinic? What kind of testing equipment, what kind of specialists, what kind of equipment do they need? So by defining these things, we're hoping to bring awareness to educate patients about what to look for when you're seeking out healthcare, number one, and also set a standard for healthcare professionals. This is the standard. This is what we need in order to support vestibular patients. So this is what you need to be aiming for. On the level, gosh, that sounds kind of familiar. On the level is VITA's quarterly magazine or newsletter. We have been on the level for a long time, but I can't tell you how many people I've talked to donors of ours who have said that On the Level is their lifeline, that they keep these editions of our quarterly magazine so that they can read through them later on and share them with friends. We have articles. We always have a patient featured story. We always have a piece on research. We always have something about coping strategies. So there's always, something in there that is useful to everyone. So this is you can get our magazine digitally, even or in hard copy. And we also have a monthly e-newsletter that has both articles and connects you to other things that are going on in the vestibular community. This is free. Everyone can sign up for it, get it in your inbox. And it also has a list of support group meetings, like the Life on the Level support group. So I think we've talked about this a little bit, but I'll just touch on it again. Our educational resources, I think, are the basis of what VITA has to offer our community. Educating, we have articles, we have videos, we have infographics, we have one-page flyers. We have so much stuff that it's hard to find because there's just so much information. But anything that if you have questions, we probably have answers. And these are all, peer-reviewed, researched, and high quality patient level information that everyone can access. So I'm hoping that, I find oftentimes when I'm in the Q&A part, when someone's like, well, how do I find out about this? I can find an article and give you a link to it. I don't know that we'll have time to do all of that today, but in all likelihood, if you have a question, we have something that we can send you that will answer that question. So I encourage you to reach out to us. As Kevin will tell you, despite the fact that the Vestibular Disorders Association is based in the United States, we really are a global community. What you guys experience in the UK is no different than what vestibular patients in the United States, in Canada, in Australia, in France experience. Certainly there are differences in medical systems, in language, but we're really a global community. And I think that we're stronger together, recognizing that, and then identifying, and this is something that, that I want to hear from you guys. What are the unique experiences that you have that VITA can support? How can we support you in that? Earlier on, I was talking about some of the partners that VITA has in the medical community. Balance Belt and Urban Polling and Avalux are some examples of that. We partner with some companies that are providing products or services to the vestibular community. We don't specifically endorse any of them, but we do feel that we can help the vestibular community learn about these tools and decide, is this something that can help me? Urban Polling was one of the first that we partnered with because I see with my mom. At this stage, my mom is she's 92. She's using a walker, but she went through that progression of, okay, I'm a little bit unbalanced. I don't want to use a cane. What do I do? And I think that the Urban Polling walking poles are such a great option for so many people who are like that. My mom did eventually start using canes, but of course they had to be designer canes because she didn't want to be seen, using a cane. So, but there are lots of options out there. And Kevin, do you want to speak about this now, or do you want to wait till
Yeah, I'll
end?
just quickly mention, as Cynthia's just said, VITA have got these partners that supply devices or treatment to our BUNS community. And basically, what happens there, Vida, as you've seen, has got nearly 2 million followers. If any of Vida's followers, that includes any of us that visit the Vida website, choose to go on to buy any of the products from the partners, Vida does get a donation, some income from that, which is great. And they also offer a discount to anyone in the balance community who's buying. Now, as the older members will know of Life on the Level, we have no money, we have no bank account, and we never will have. But again, through this connection with Vida, we've been able to talk to some of Vida's partners, and they've agreed to supply a limited quantity of free stuff. And later this year, we're going to launch what we're calling Life on the Level, the foundation, where for people who genuinely cannot afford to buy these devices, things that, for example, Balance Belt can actually teach some sufferers how to balance again. For those that genuinely cannot afford them, we will have the ability to give some of these products to people, which I'm delighted about, because as Cynthia may not be aware, we've got the NHS, which is supposedly medical treatment free at the point of delivery, which such as Sarah Burns works in. But we all know we haven't got enough experts because we can wait 1 or 2 years to get a diagnosis or treatment. So I'm delighted for those, especially who have not got a lot of spare money. Later this year, we're going to be able to start to give those people things that could improve their lives. We'll also have, by the way, links to all of the partners. So perhaps don't rush out and buy Urban Polling Polls just yet, because in a couple of months, you'll probably be able to get them for a lot lower cost, just by being a member of the support group. And Vida will also get a little bit of income from that purchase from the supplier. So that's the exciting news. There'll be a lot more about the foundation in the next couple of months. But again, all thanks to Vida's great work in what they're doing. And just a little bit that Cynthia mentioned before, I honestly believe we have so much in common. The Americans do speak a funny English, that's true. Different time zone, but when you've got a balance condition, doesn't matter what language you speak, it doesn't matter which country you live in. If you've got Meniere's, you've got Meniere's. If you've got triple PD, doesn't matter where you are. So it's brilliant to see all this work. Cynthia, back to you, because I know you've got a couple of more slides, but thanks very much.
Thanks, Kevin. And thank you. Some of you may know, I don't know, Kevin has been helping Vida for many years develop these relationships with some of these partners, and he's wonderfully persuasive in getting them to give discounts to all of you, and to help support Vida, because we can't do it alone. And speaking of volunteering, we do rely, as I said, we're 6 people. We rely on our volunteers all over the world to help us. I was talking about our virtual conference. It's all run. I mean, we have staff members that take care of the logistics, but all of the organizing of the speakers, and co-hosting it's done by volunteers. We have volunteers that do all sorts of things, both patients and healthcare professionals. Our healthcare professional, all of our articles are written by healthcare professionals, and they're all volunteers, and no one's getting paid to do that. They do it because they're passionate about making sure this information is available. We have volunteers who help, behind the scenes, with copy editing. We have volunteers who help us, when someone first joins Vida, some volunteers will contact them and welcome them to the community. Our support group leaders are all volunteers. We have several committees that volunteers serve on. And because, committees meet like on a platform like this, volunteers can be from anywhere and do that. So we have a patient education committee where we brainstorm some of these topics. What's a topic that we haven't written about that patients want to hear? Let's brainstorm that. We have a community support committee that is always talking about how else can we support our community, patients, healthcare professionals, and caregivers. Your family. We actually have a Facebook group that is specifically for family members, and it's kind of small right now. We really are looking to get more people participating in it because we really believe that there is a need for support for spouses and other family members of people who are struggling with vestibular disorders, because they're impacted too, and it's probably hard for them to, they don't have anybody to talk about either. They don't want to, they don't know how to talk about it. They need a safe place to do that. So we also have our medical advocacy committee. It manages our patient registry. There are lots of ways to get involved, and don't try to think of, don't try to put yourself in a square or in a little, think of what is it, the patient education committee? I should just let us know that you want to be involved, and we'll figure out how that works. There are all sorts of ways to volunteer. And of course, we survive on donations. We're not a government funded organization. We don't get lots of grants. We survive on people making donations, and my experience is that people who have been impacted by vestibular disorders who want to give back, they understand that giving back, giving a small amount, any amount that is meaningful to them makes a difference. It really does. We are not making money on this. I'll tell you that. We are just trying to make sure that we can be here tomorrow so that these resources are available to people. That's it. And that's pretty much it. I wanna, I know Kevin kindly explained that I've been struggling with COVID for the past week, and I want to apologize that I'm not on my best game today, but thank you for listening. Thank you for supporting VIDA, and I would love to answer any questions that you have, or at least try to.
That's brilliant, Cynthia. Thanks ever so much. And what an effort with COVID. It's been spectacular. I think now, Kelly, you may have. I did see in the chat a few questions. There may be one or two that are more appropriate for Sarah.
Yeah, I've seen one that's more for Sarah.
Expert. If I could just start off, Kelly, before you got any other there. I know I get asked the question quite a few times. We've got over here the charity, the Meniere's Society, and people are always curious of, do they overlap or do they do different things between VIDA and Meniere's? And what's your view on that one?
Well, I would say that I work with a lot, I partner with a lot of other nonprofits. There are a lot of nonprofits that are more specific than VIDA, for example. VIDA is an umbrella organization for all things vestibular. Whether you have Meniere's or vestibular migraine, triple PD, or whatever. It's a community that includes all vestibular disorders. I know that the Meniere's Society in the UK, even though Meniere's is specifically in the name, I know they've really tried to expand and to be for all vestibular disorders. But I think we overlap in some ways, and we also are unique in others. I think that VITA's focus has always been on, first and foremost, patient education and support. That's how we were founded, and it's always been our focus. And I think the Meniere's Society is a little bit more focused on providing research funding, which is fantastic. Not as much a community-based organization. And that being said, we do partner on Balance Awareness Week, so I really see that there's a space for everyone, and VITA's space, if you will, is really to support patients where they are in their recovery.
Brilliant, thanks, Cynthia. Kelly, do we have any questions for Cynthia?
Yeah, there's two or three questions in the chat box that I will read out to you, Cynthia, but please, if you're not sure or you think it's more suitable for Sarah for you to answer, please let me know and I can put them to Sarah later. That's not a problem. So there's a question from D-Ross, and she's put, could Cynthia please explain a little about a central vestibular disorder, which they understand is not an inner ear problem. They're finding that so much information is related to audiology and ear issues, and it was 5 years before someone explained the difference between a central and peripheral disorder.
Absolutely. I'll touch on that with the disclaimer that I'm not a healthcare provider. So my explanation will be what I have learned in my role working with VITA, and I'm sure that Sarah can explain more. But I think it is really interesting and important to understand the difference between central and peripheral vestibular disorders. So, peripheral, when you think of it, it's on the periphery, on the outside, which is the ear. The ear is on the outside of the head, and the inner ear is where the balance organs are. So there are structural problems that can occur in the inner ear that can cause balance problems. Meniere's is a great example, or BPPV is a great example. When BPPV, the crystals in the inner ear get out of place. That's like when I say structural, there's some structure that is actually changed that is causing the problem. Whereas central is central nervous system in the brain, or in the nerves leading from the inner ear to the brain that can cause the problem. Vestibular migraine is a great example of that. And one of the important things in distinguishing between peripheral and central vestibular disorders is who handles them. In the US, we have an ENT, an ear, nose, and throat doctor. ENTs, or neurotologists, is another subspecialty that specializes in vestibular disorders. They would deal with peripheral vestibular disorders primarily, whereas a neurologist would be the person that you need to see for central vestibular disorders. And I think that that's a big problem in getting to the right specialist, is not being able to differentiate between the peripheral and the central. Or I think initially, the peripheral vestibular disorders are more common, at least more people recognize them, and you might get put into that category. You might go down this diagnostic road thinking, oh, it's this, when really, if you had been able to recognize that it was central earlier, you might have been able to go down a different diagnostic road and get diagnosed more quickly. And that's one of the reasons that VITA several years ago came up with something that we call our vestibular triage protocols. It's a really simple way to differentiate between central and peripheral vestibular disorders, and also forms of dizziness that are vestibular versus not vestibular, because there are cardiovascular causes of dizziness as well. But to be able to differentiate between the cause so that you can get to the correct specialist, so that you can get diagnosed more specifically.
Yeah, if
Do
I
you want to
can
expand
just
on that at
mention,
all?
just mention on that, since Sarah might want to talk, the just feedback really on what we've experienced as a support group. In the UK, there's tremendous disjointed care between those two, the neuro and the vestibular. Generally, a lot of members say they were treated down one route, they kind of get to a dead end, but no one is explaining they should then consider looking at the other possibilities. Hopefully, that situation is improving, and I can't comment on which particular consultants do or don't join at the dots, but we generally, I don't know if it's the same in the USA, but in the UK, there seems to be very little joined up thinking, and lots of people and departments work in silos. And I think probably the biggest driver of that in England is just lack of resources, money, time. So it's very difficult to cope with the core demands on consultants and departments, let alone start to think, I wonder if they could help there. We had a similar thing just in Leicestershire. We have a resource for treating people suffering with serious levels of anxiety due to other health conditions. They were predominantly treating people with chronic pain. That department had no idea there was a balance department in the same hospital, and the balance department had no idea the health psychologists existed. Happily, they both know now, and one can refer patients to the other. So it's really difficult. And this again, I think, is where you do a great job, and hopefully we contribute in raising the awareness, even to individuals, that the last thing you can do is be absolutely sure your consultant knows everything. So don't be afraid of asking awkward questions and saying, well, I did see this video one day. This lady with COVID did explain. Just quote us or quote Vida when you're with your clinicians if you suspect you could get to a better answer. Because we've had too many stories of people being wrongly diagnosed or just ignored. I had a case recently of a new member saying he was just told that's as good as it gets and basically go away. It's not good enough. So we've all got to fight to get that treatment. Sorry, I'll shut up again, Kelly. Or Sarah, do you want to come in at all on that last point that Cynthia was talking about?
I think Cynthia did a great job of explaining that. The only thing I would say is it's very difficult to be specific because central disorders cover so many pathologies. So it depends on exactly the cause. Some people get a little bit nervous when you use the word central or the brain. And of course, sometimes, it is a serious and sometimes it's a degenerative condition, such as aging brain, cerebellar degeneration, that kind of thing. But it also covers things that are very treatable, like migraine. And even those who do have changes in the brain can still benefit and still improve with rehabilitation. So although as soon as you say brain, it can sound a little bit scary, it can be more complicated for sure, but just to be aware that obviously depending on your specific problem, because it might be that needs treatment. Obviously, it covers everything from, I say, migraine to degeneration to MS, that kind of thing, and it depends on what's going on. But aim to get a diagnosis if you can, aim to get any treatment that's relevant, and then but don't, and I said this at the last meeting, keep hope. Your brain is incredible at finding ways around things. Neuroplasticity is happening all the time. So don't sort of be afraid that just because it's central and it's sort of in your brain, that means that you can't get better, because it doesn't. And I have seen some incredible improvements in patients with central vertigo. So yeah, that's it. And I think Cynthia explained everything else really well.
Fabulous. Thank you, Sarah, for that input. Cynthia, another question that's coming from one of our people today is, in the UK, they have the impression that the medical care in the US is very much constrained by insurance cover and costs, and they want to know to what extent does this or apply, or obviously not apply, to the treatment of balance conditions. Is it similar? Yeah.
Yes, definitely. There, one of the challenges here, and I don't know if I'll explain this very well, but is, with insurance in the United States, some there's something called the DSM diagnostic something manual that says whether something will be covered by insurance or not. And if you're not in that, if you don't have a code or
Right.
a particular diagnostic process or treatment process doesn't have a code, then it doesn't get covered. And it's even more specific than that. So this code can be used by an audiologist, but not by a physical therapist or vice versa. So it makes it very difficult. There are a lot of, I've heard from medical doctors that they do not want to treat vestibular patients because they don't get reimbursed.
Okay.
And that's one of the problems
Mm.
in getting to because you need to see a medical doctor to get a diagnosis. You can't get treatment without a diagnosis. It's
Mm.
kind of backwards and oftentimes counterproductive, but that's sometimes what happens because there are so few medical doctors that specialize in vestibular disorders. And one of the reasons that there are so few is that there's no financial incentive for them, unless they're doing surgery, and there's so many, treating Meniere's isn't about surgery.
Mm.
So there are very few medical doctors that will, that will take the time to support a vestibular patient because they're not getting reimbursed. Or another example that I've heard is a patient goes to an audiologist for testing, and the audiologist determines that they have BPPV, but if an audiologist does, and they may know how to do the Epley maneuver or another type of maneuver to correct BPPV, but they don't get reimbursed for it. So they have to, send them to a physical therapist, which takes another couple of weeks. So they have this delay only because they wouldn't get reimbursed for doing that maneuver. So it's definitely a problem here.
Mm.
And to add to that, the United States has individual states, and insurance is different in each state. Each state,
Right.
the laws of each state uh, manage the insurance of so for example and also the healthcare professionals, and it's actually telehealth laws are a big legislative concern right now because during COVID our telehealth laws were lifted so that, for example, a doctor in I'll just say Oregon, where I live, if there was a specialist in Oregon and you lived in Montana, where there wasn't a vestibular specialist during COVID, you could see that doctor via telehealth. Now that the telehealth rules have been are back in play, that can't happen. You have to
Right.
be you have to actually be in the state that the doctor is practicing in order to see them, and that makes it more difficult to get to a specialist. So those are some of the advocacy issues that that we're working on, that we're supporting. In the United States, and I know that it's the same in the UK because I've worked with your professional associations. There are professional associations for each of the specialties. So there's a professional association for physical therapists, and oftentimes there's in the US, and I know in the UK, a subgroup within there for vestibular physical therapists. There's a professional association for audiologists and for neurotologists, and they have advocacy arms that lobby our government to make changes to these laws, and we don't have the resources to do that kind of lobbying, but we support that by sending in letters of support, by trying to have our community come and contact their legislators to let them know we're in support of this new law or this bill. Yeah, I hope that answered your question.
Yeah, no, that's really helpful, and it just shows that there's challenges over the pond as it is here just to get those diagnostics done.
Kelly, just quickly add to that. It strikes me there are two different health systems, but both have got their own particular problems, which boils down to stopping people with a balance condition getting accurately diagnosed quickly and then treated quickly. I often get into discussion with people who live in the UK, and they say, oh, they wouldn't want to be in America. It's this awful system where everything has to be paid for and it's through insurance programs. And I just remind them with regards to balance conditions, we have free at the point of delivery treatment and care if you can get it. Now, we've got, such as Sarah said, brilliant, dedicated her professional life to looking after us dizzy folks. And most people you meet who treat our community are brilliant. There's just not enough of them. So even though the NHS is free, it's not much use to you if you can't access it. And America, yes, has got different problems. I think, again, the commonality, I suspect, is driven on both sides of the Atlantic. What we suffer from are hidden disabilities. And unless you get very close to either having one yourself or living with someone who's got one, you have no idea how significant these problems can be. And then I think we just lose general interest and support with the wider community, politicians, people who decide where money gets allocated. And that comes through our different systems as different kinds of problems, but I think they've all got the same root cause. And I just mentioned, I'll get off my soapbox then, that's where VIDA and Life on Level, we should encourage all of us, anyone who's touched with a balance condition, let's make more noise. The more we tell people about what's going on, not in a poor me, pity me way, but in terms of these awful conditions that can strike you down and leave your life in tatters, as well as the psychological suffering. The more we talk about this, the more people understand. Hopefully one day, the better care we'll get. But at the moment, we certainly in the UK, we're going backwards. And that's why we're here to help people who just can't get to see a professional. I'll be quiet again. Back to you.
No, I thought that was great, Kevin. I just want to, tag along on that. If you look at some other really high profile conditions out there, Parkinson's, for example, or AIDS, the reason that they are well known and that there are treatments is because of awareness campaigns, grassroots awareness campaigns. And that's why I feel like we need to, VIDA can't do it alone. It really has to be a global effort where we are all sharing the same message. Because when Kevin, you're a marketing person, you know, when you're sharing the same message, when people hear and see the same thing over and over again, then it becomes normalized.
Sadly, when I came into this, I've suffered over 20 years with many years, but it was only 5, 6 years ago when I got involved with what could I do. And there is just so much disinterest in balanced conditions from the outside world. It begins with, I don't know if it's the same in America, but my typical response here, even from some of my friends to this day, is balanced condition. Isn't that when you drink too much beer and the room spins, or isn't it when you go on one of these events that experiences that spins you? So there is just a general dismissal of the condition doesn't exist in so many people's eyes. And there's one other problem we've got is most of us aren't ready to jump out of our house, leap into a car and attend a rally anytime soon. We've got these disadvantages. Many of our members can't even turn up for these Zoom meetings because of the visual and audio difficulties. So it's difficult. There are many of us out there, but we are all in our own little homes and not together. And if only we could get us all together in one place, it might be a bit of a vote winner. But at the moment, the answers don't sort of jump out. And again, I'm sure America's the same. We are in this crisis of far too little resources for medical services. Even Professor Ray was saying there is a problem even if resources come through at the moment, because there's general disinterest within the medical establishment for people to learn about or specialize in the area of balance. So I often refer to the pantomime Cinderella and say, sadly, currently we're the ugly sisters. It's got to change, because we want to be Cinderella. We do want to go to the ball. But it's going to take a lot of time and effort. But just while I can, Cynthia, thanks so much for your efforts over the years. And hopefully today people have seen a little bit more of what VIDA is. And I can assure everyone it's only that because of this lady here, that she's been the driving force to make it happen. So on behalf of us all, thanks very much. Thank you.
Thank you, Kevin. Thank you, everybody. Thanks for having me.
Been a pleasure. You get back to bed now. It's 8 a.m. West Coast. Yeah, go rest. But thanks ever so much for being here, Cynthia. Thank you. Bye-bye. Right, we will. Let me pin myself back on. Just before we go to Sarah, and apologies, Sarah, we dramatically overran. So where I was hoping to invite you to give us a quick chorus from your choir, as you did with Britain's Got Talent, we're not going to have time for that. And also, I've just got to quickly try and insert this public information notice. We're getting increasing problems with email. Hopefully you can see this document. Don't worry if you can't read it. I'll try and make it a bit bigger. I've put it on here so anyone watching this video in the future might read this and wonder why they're not getting emails from Life on the Level. We've got a problem. There's so many of us. There's over 300 of us in this support group. We have to use software to send emails out. Ours is called HubSpot. HubSpot insists on trying to track every email it sends. And because it's a professional platform, some people's emails, the software you use to receive emails, it sees my email address as spam, God forbid. So I find myself weekly being put in people's spam folders, trash folders, all over the place. What can we do to stop it? Because if we don't, you won't receive invitations to these meetings, for example. And the trouble is, you might have received my emails for the last 3 years, and this problem can start tomorrow because it's down to your email provider and the settings, they keep changing when they do an upgrade. So it's general information. All of you I know today have received emails, or you wouldn't be at this meeting. But as I say, hopefully people in the future watching this video thinking of joining the group, they might be aware there could be a problem. So start with checking your spam or trash folders. When should you check them? Well, we send emails out at least one every month. So if suddenly you go for more than a month and you've not seen an email from myself, could be a problem. We send a lot more emails around the dates of meetings before and after. But if you're not seeing Life on the Level emails, it could be they're going to a junk folder, trash folder, spam folder. There is a way, if you use Outlook, to whitelist, where you right click on one of our emails and then select the junk section and say, do not ever send this to junk. We do unfortunately have some emails that can't receive support group emails. The only way around that is to look at getting an alternative email address and let us know, let us have it. So apologies for this problem. I had 3 members in the last 24 hours desperately wanting the meeting link, even though we'd emailed them, for just this problem. So I thought I've got to officially mention it, but it's more for the benefit of this video for people looking at such as these meetings, and we'll try and put a message up on the website as well. Anyone who's struggling, and lots of us do struggle with email settings, my advice is, I've got kids and they just roll their eyes at dad because he doesn't know what he's doing with technology anymore. So get your kids on the job, or family, other family or friends, anyone who can look to whitelist our email address. And thanks very much. That's the end of the public information announcement. Now, quickly over to the wonderful Sarah Burns, who we're going to hear from. This, by the way, we've called the mini presentation because Sarah knew she was going to share the meeting with Cynthia. And what we're looking to do at a later meeting is a longer, more intensive mindfulness session with Sarah. Because I know at the end of the presentation, there's going to be 1 or 2 questions, Sarah, anyway, about all sorts of things. So I'm going to shut up. Sarah, if you want to start to share screen, and over to you for presentation, please.
Okay, thank you, Kevin. I just need a disclaimer. First of all, this is my first presentation over Zoom. So let's see how it goes. Okay. Can you see that?
Yeah, that's fine. That's lovely.
Okay. So, mindfulness for the dizzy patient. So first of all, mindfulness is something that I discovered about 7 or 8 years ago. And obviously most of us have heard of it at least, and I'm sure some of you have tried it. At the last meeting, if you were here, I asked if anybody fancied doing a little one that they could do online and feed back to me, and at the end I'll see if anybody managed to do that, if they want to very quickly, because I think we're going to run right over, if they want to quickly feedback. And the other thing before we start, because I am going to do a little meditation at the end of this, I'm going to try and keep it the rest of it short so we have time for that. The meditation's about 6.5 minutes if you fancy it. And what I'm going to encourage people to do with that is to, if you can, write down somewhere, you don't have to show anyone, how you're feeling now before the meditation, that's mind and body, and then how you feel, it can be just one word, afterwards. And again, if anybody wants to quickly share it at the end. Mindfulness is, just briefly, I went on a course for mindfulness purely for myself. although I use it for work now, I did it for my own issues with anxiety and stress. And I went on an 8-week mindfulness-based stress reduction course, and I found it so incredibly helpful that I thought I needed to share this. So this is what's coming up. I'm aiming to talk for maybe around 20 minutes. Maybe that has to be a bit shorter now. This is what's coming up. What is mindfulness? How can it help me? Common misconceptions. Is there evidence it works? How do I meditate? And then we'll do the meditation at the end together. So mindfulness. So really, this has its roots in ancient Eastern, including Buddhist, but not just Buddhist, techniques and practices. So there is evidence that from many, many hundreds, if not thousands of years ago, this was being practiced, particularly in the East. And a chap called Jon Kabat-Zinn, that you may have heard of, an American, he took the principles, he brought them over to the West, and he used them in a pain clinic. And this was a pain clinic where a lot of the patients had given up hope. They had seen every possible practitioner and were getting nowhere. And he took this group, and rather than approaching it with how are we going to stop your pain, how, you know, in terms of medications or treatments, it was about how they could use their mind to connect with the pain, and in doing so a lot of their pain improved, and it was remarkable. There's a little bit of footage if you want to look on YouTube where you can see him doing that. It's from the 60s, so it's an old footage, 60s or 70s. And so for instance, he would ask people to imagine to feel their pain, but then to imagine they were riding the pain as though it was a wave on the ocean, so that you're with it, you're not fighting it. And it's fighting our bodies that sometimes causes more issues. So the definition, if you like, is paying attention to the present moment on purpose without judgment. Now, what that means is it doesn't have to be in a meditation. You can do that in any task, anything you're doing at any moment of any day. It just means having your awareness in what's around you, using all 5 of your senses, rather than getting lost in thought, either thinking about what's coming up, where you've got to be, or what's just happened, what that person said to you that you wish you could go back and answer differently, all those sorts of things. We tend not to live in the present moment, and in fact studies show that we spend 47% of our time lost in thought. That's not including sleeping time. 47%, so that's half of our lives we are not paying attention to. And then I've just put at the bottom there, thoughts are not things, and you are not your thoughts. Thoughts are not real. You can create a narrative in your head. We're very good at doing this, aren't we? Particularly when our head hits the pillow at night time, where you suddenly start thinking of all the things, and usually they're negative things, and you ruminate on them. But those thoughts are just thoughts. They're not necessarily real. So how can it help me? So you as a dizzy person, or as a person with any chronic condition, mindfulness has been shown to help those with vestibular disorders, but a host of other chronic conditions and pain. There is a plethora of studies, a huge evidence base, proven to reduce stress. And we all know that stress makes dizziness worse. For those of you that don't know, I don't know if Kevin mentioned before, I get dizzy a lot myself. In fact, I've been quite dizzy this week. I get BPPV recurrently, and I can get it complex presentation where I get it in both ears at once, different canals. So I do know the sensations that come along with being dizzy. And when you're tired, when you're stressed, it gets worse. There's some evidence to show that practicing mindfulness with a balanced condition can help the relationship between the brain and the body, and helping it to orientate the body in space. Now, this is really important. Somebody on the chat's asked me, Vimla, I think, about visual preference, visual vertigo. It has various different names. And that is something that is often secondary to a balanced condition. It's your brain trying to be helpful. So it's technically not physically caused by the inner ear, but it's your brain, and it's maladapted. So what's happened is your brain has realized your inner ear is giving incorrect information, and to be helpful, it starts to use your vision as your dominant sense. It uses the vision as a movement sensor, but unfortunately that causes its own problems. And therefore, things moving around you, try not to move too much because I know movement bothers the audience here. But movement in front of you can then trick your brain, and you perceive that as you moving, and therefore you get this horrible conflict that goes on where you can't tell if it's you that's moving or the thing or the people that are moving around you, and it makes you feel really horrible, and it makes you avoid going to those places. So one of the things that mindfulness can do is it can improve that connection with your brain and body, because we want your brain to go back to listening to the information from the inner ears and the body, not just the vision. Meditating can help you cope with your symptoms. So mindfulness can be a coping strategy for many people with chronic conditions. And if you see it as a way of sort of befriending your body, now that might sound a little bit airy-fairy, but what we mean by that is that it can be easy when you have physical symptoms to see your body as almost the enemy. You're not happy with it. But if we change the perspective and try not to fight our own bodies, we can get some really good results in improving symptoms. So overthinking. So this is one of the main things that mindfulness will help with, because in stopping overthinking, we can stop the chain of stress reactions. So we spend a lot of time thinking. If you think about it, when you think about things, if you're thinking of a problem, for instance, most of us are not thinking, oh, we'll probably solve that. I'm sure everything's going to be absolutely perfectly fine. Some people will. We have the optimists among us, but a lot of the time our thoughts are negative. And these are some of the things that our vestibular patients will say. They think they're never going to get better. They used to enjoy their life. There's so many things they've stopped doing. What if they lose their job? What if they can't carry their children up and down the stairs to put them to bed? What if they have to stop driving? All sorts of things, if they can't do the things they used to enjoy. And feeling as though people don't understand them, even friends and family, like feeling as though they look drunk when they're out walking. And because it's an invisible condition, feeling that even their partners, family don't really understand how it feels. Now, those thoughts are not helpful. Every time you have a thought that is a stressful thought, those hormones are re-released into your body every time you think about it. So we can have something that happened to us. So for instance, if you had an episode of dizziness, which was really awful, if you relive it and think about it, every time you think about it, your body's releasing adrenaline and cortisol, and it's as though it's happening again to your body. But actually, we're doing that. We're doing that to ourselves by going over it in our minds. That's not to say it's not a completely natural and normal thing to do, but we do benefit if we can stop and slow and calm our brain and our thoughts. So mindfulness practice can stop the brain from constant thinking. And this is something that I found when I did my course, is when you first start mindfulness, what you'll find for sure is you will struggle to keep your mind focused on whatever it is. That's completely normal. Doesn't mean you're doing it wrong. But the more you do it, the more your brain will naturally be able to stay focused. And what happens over time, if you practice a little bit every day, your brain will fall into this default not always thinking situation where a stressful thing can come up and you won't have the same reaction to it anymore. Your brain doesn't go down the spiral of what if this happens and what if that and what if I can't do that, that we often lead to ourselves to, even before we know what's going to happen. We can catastrophize, we worry about the future, and we all do it. And I found personally that I was stunned at how really stressful things could crop up, and I didn't react the same way anymore. I was much more measured and logical and calm, and my brain wasn't just automatically thinking. Now, this is an amazing thing. Over time, study shows mindfulness changes the structure and functioning of the brain. And I've watched a host of TED Talks. I've got some links at the end for you. This is incredible. So it's been proven time and time again using fMRI, that's functional MRI scanning, that practicing mindfulness reduces or shrinks the amygdala, which is the fight, flight, or fright part of the brain. It shrinks, and it increases and thickens the areas of the brain which are responsible for contentment, happiness, and well-being. That's shown on MRI to happen, not just from what people report, which is incredible. So again, it's neuroplasticity, which we're using when we do vestibular rehabilitation. We are asking the brain to change, and your brain, if you practice something enough, will change. So on that third point there, with mindfulness practice, we meet ourselves where we are. We're not striving to change anything. So that's something that sometimes is difficult to get your head around, because you think, oh, well, surely I'm trying to make myself feel better. But you have to go into mindfulness with an open mind, not striving, because striving is quite a stressful thing to do. Because if you're striving, then you can fail. And we just want to meet ourselves where we are. That means however we're feeling, whatever our minds are doing, you can't do mindfulness wrong. Everyone can do mindfulness if that's something they want to try. So some common misconceptions. So when people come into my clinic, I used to do a mindfulness clinic, which unfortunately I can't do it at the moment just because of the demands on the service. So we don't have time for mindfulness, I'm afraid. But I always recommend it, but I don't have time for the meditations. But there's always what I call my non-believers who come in, and they are often, they've heard of mindfulness, they see it as something to be a little bit airy-fairy. I've been called Mother Earth before, and they see it as something that's sort of a bit alternative and, associated with things such, being vegan or a vegetarian or, a sort of hippie mindset. And it's not like that at all. But mindfulness may not be for everyone, but I would always encourage people to give it a try. So here's the first most common misconception. You need to empty your mind. You can't empty your minds. We shouldn't be trying to empty your minds. Your mind's job is to think and think and think. That's what we do as humans. We need to do that. It's impossible to empty your minds. All we're doing is trying to focus on the present moment. If we have a thought, we notice the thought and we come back to the present moment. That's it. And that's the same for everyone. You need to sit cross-legged on the floor. That's a little bit tongue-in-cheek, that one, but some people do think you have to sit in the Om position, burn some candles and some incense. Not at all. You can sit, lie in any comfortable position. You need to be in peaceful surroundings. No, you can meditate anywhere. Not just meditate, but you can be mindful anywhere. You can eat mindfully. You can walk the dog mindfully. You can do your work mindfully. You can fold your laundry mindfully. You can do absolutely anything. As long as you're bringing your attention to it, you're being mindful. And the other thing is that you need to be a spiritual person. No, anyone can benefit from mindfulness. And for those people that do are a little bit skeptical, I do call it brain training instead, because that is what it is. And brain training sounds a little bit more acceptable to some people, but your brain will change if you practice. Is there evidence it works? Yep, there's a large body of evidence that it shows that it changes the brain, and anecdotally, people will tell you that it improves their feelings of well-being, their feelings of motivation, feeling positive. Mindfulness is even used in prisons in the UK, believe it or not, to modify behaviour, and it works really well. Kelly's nodding away there, she knows. Which is incredible. Studies have shown it improves emotional and physical well-being, mood, the healing process, pain, anxiety and depression, the immune system, memory and focus, brain aging. So studies have shown that it slows down brain aging, sleep, and it increases compassion and empathy, which is really interesting. And with that one, because we're showing compassion to ourselves, it extends then in showing compassion and kindness to others around us, and being non-judgmental. So how do I meditate? So choose somewhere comfortable to sit. So your posture, ideally upright and relaxed. You can do it lying down, absolutely, but if you think you might fall asleep, falling asleep is not, there are no mindfulness police going to come and get you for falling asleep during a meditation. And we've all done it. I've done it many, many times. It's absolutely lovely to go to sleep actually like that. But for mindfulness to do its thing, we do need to be awake most of the time, because we want to be alert and conscious and focused. Turn off distractions. Maybe let people know that you're going to go and have a little meditation. You can close your eyes, or you can leave them open with a soft gaze. And then you can use a guided meditation, and there are thousands. I just did all of mine on YouTube. So you could choose somebody whose voice you like, or whose background music you like. Choose one that suits you so that it's not distracting you throughout. If you've got somebody with a particular accent that kind of grinds on you, don't choose that one. Don't try to force your mind to be quiet. You just can't do it. You won't even know your mind is gone. You'll just realize it's gone, and it could have been gone for a long time. You realize that you've actually been thinking about shopping and dinner and picking the kids up, and that is fine. You don't judge yourself. It's all done with kindness. You bring your mind back to whatever anchor you were using, whether that's your breath or the body scan, which I'll talk about in a moment. And if you have any sensations of dizziness or pain or discomfort, it's about trying to notice them and be with them, not fight them or try to change them or wish them gone. You're just going to try and notice them and sense them. And then again, don't judge yourself if you're finding it hard to keep your focus. You absolutely can't do mindfulness wrong, and anyone can do it. And if you have spent the entire guided meditation thinking of something else, you still try to focus, and the next time you might have more focus, and it will gradually improve until you find that you can quite easily stay focused. But even then, your mind will always wander. So that I went to my meditation now. So before we start, if you don't fancy it, don't feel any pressure to do it. If you did want to write down a word beforehand about how you're feeling right now, you could write a word about how your body feels or how your mind feels, or both. And then you can write the word down, and it can be just for you. I'll say if we've got time at the end, we could do some quick shares, but I know we're running out. This is a 6.5-minute meditation, which I recorded. Here's one I made earlier. And I have got a couple of link slides after this if you wanted to look a bit further into it. But I would just say from my personal perspective that it has helped me more than I can say for many, many years. I've been through a lot of things, particularly in the last few years. I've had a really difficult couple of years, and this has been fantastic, and my mind will naturally be less stressed, less anxious, and I don't have my mind spiral quite so often, which is where you start with one thought and it get more dramatic, and all the way to absolute catastrophe. So if you're feeling ready and you want to have a go, just remember, no judgment on yourself, you can't do it wrong. Then I will start my recording. Kevin, if this audio doesn't play, let me know. Okay, here we go.
Can't hear it.
How's it gone? Hang on, let me go back. Right, let's try again. And I'm going to do it too.
No sound, Sarah. Sorry, it can be difficult on Zoom. For some reason, it seems to block out other sounds.
Oh, that's annoying.
The
I wonder if I can play it from my phone. Just bear with me.
yeah, try. Don't worry. It's been a wonderful presentation so far.
Oh,
So,
thank you. Okay, I'm just trying to find my audio files.
you do that. I'll just remind everyone that Sarah, as she said, not only professionally for 25 years been treating people like us, but suffers with her own balance condition, and then has found mindfulness so great for her. I think compared to a non-balanced sufferer telling us about mindfulness, we get so much more from Sarah with a hands-on experience of treating us, being a sufferer, and knowing how well this has worked for her. And I was one of the non-believers 5-6 years ago. I used to laugh at the term. Now I happily do it automatically when I'm riding my mountain bike. You can do it anywhere, and it really helps. It does eventually bring peace where there used to be a lot of turmoil. Ready to try again, Sarah?
Yeah, let me just very quickly. I think, is this the one? Okay, so I'm just going to try and play it from my phone. So let me know if you hear it okay.
Yeah. It's something.
Okay. Sitting comfortably now with an upright, relaxed posture. close your eyes or leave them open with a soft, unfocused gaze. You're safe, you're warm, you're at home in your body. Your body is your friend. It's doing its best. Notice the sensations of the breath now. You don't have to change your breathing. You're just feeling the breath in and out. Feel your abdomen rise and fall. Feel the air as it passes through your nose, your mouth. On your next breath, imagine you are filling your whole body with air. Imagine it reaching every part. Now feel the sensations in your feet. What do you feel here? Whatever you feel, notice and sense. Or maybe you feel nothing and you'll notice that. Come further up the body now to the sensations in the legs. What do you feel here? If there's any discomfort, that's okay. You can notice without drawing any judgments, without thinking of it as bad or good. Just being with it. Come further up the body now to feel the sensations in the torso and the back. Do you feel the back in contact with your chair? Is there tension or discomfort? If your mind wanders, that's perfectly fine. It's normal. Just kindly, gently guide your attention back to the body. Let go of the sensations in your back and torso, and now think about the sensations in your hands, your arms. Are they warm? Is there tingling? Vibration? These are feelings of being alive. Bring your attention now to the neck and shoulders. This can be where we carry a lot of tension. Just noticing the feelings there. Breathe in and feel the sensations and feelings in the head now. This can be where a lot of the unpleasant, uncomfortable feelings arise. Maybe you feel a sensation of dizziness or movement. Maybe it feels heavy. Maybe it feels as if it doesn't belong to you. Whatever you're feeling, that's okay right now. You're just being with those sensations. Bring warmth, kindness. Bring love to those sensations. Relaxing the muscles in your face. You can gently open your eyes now. Bring your awareness back into the room. You are warm, you are safe. You are at home in your body. Okay, so you have to wait for the temple bell to finish ringing. That's the rule. So, did everybody hear that okay? Okay, now what? Now I can't hear you. Does anybody like to briefly feedback on how they felt doing that, or did they write down any words? To anybody? I can't at the moment. I can't hear anyone for some reason.
Oh, can you hear me, Sarah?
Yeah, I can hear now.
You can hear, that's good. Well, if I start the ball rolling, because before the session I wrote down the word alert, because my mind's always racing when doing a meeting, but I nearly managed to go off to sleep somewhere there. So very relaxing, great voice, talking it through, lovely, really relaxing for me. So I think you're going to find we're going to get a petition up at the end of the meeting for a whole series of these recordings. But I don't know if anyone wants to put their hand up or wave if they've got any comments to make. I can see you all. Oh, I've got one here. Yes, please. Oh, sorry, I've accidentally. If you unmute and go ahead. That's it.
Ronan here in Galway, Ireland.
Hi,
Ronan.
That was terrific, Sarah. I've done some meditation in the past, and it just keeps getting better. I was just wondering if you have any videos on YouTube. That's a question.
I don't know. Yeah, maybe that's something I can look at.
Very good
As I say,
question.
Ronan looks like the most relaxed person I've ever
Yeah.
seen in my life.
Roland, we're definitely going to get that petition because I think we all need more of Sarah and recordings. Brilliant. Thanks, Roland. And say you look very, very relaxed there in Ireland.
Yeah, so we don't want to disturb Roland anymore.
Thank you. Anyone else with any questions? Sorry,
see.
Kelly, you should be doing this. Where's she gone? Kelly's.
Yeah, we've got some comments, I think. I don't know where Kelly's.
Yeah, I think Kelly got disconnected and is back. I think that's why Kelly wasn't here. She's coming back. But that, honestly, Sarah, that was superb. And even playing through the microphone, I think it would have been even more.
Yeah. I noticed that Neva said in the comments that we needed to share the audio when sharing the screen.
Yeah,
I'm not very technical, Zoom.
We'll do better next time.
We will.
Practicing.
I was absolutely delighted that I'd managed to embed the audio in the slide at all.
Good. If you want to share your last few slides with us, I just
Oh
did
yes,
some sharing to view the gallery,
right.
so you
Yeah,
might
yeah.
share
Okay.
and talk us through that. Just check. I
Right.
think there's a few people asleep now.
Yeah, we've lost them all. Okay, where are we?
From current slide.
There we go. Skip to the end.
Yeah.
I'm going to go on my transitions. So this is a book. This is where it began for me. So the course that I did was using the work of Professor Mark Williams, who's from the Oxford Centre for Mindfulness in Britain. And I really, really enjoyed this book, and it really spoke to me, and it's very, very highly regarded. I've got an Amazon link there for anybody wanted to have a look at that. And then also, on my next slide, those are Mark Williams meditations at the top, which are on YouTube. Somebody's kindly uploaded them all to YouTube, and they're different, various lengths. So he has, for instance, a 3-minute breathing space, which is great if you've hardly got any time and you're just really frantic or rushed, or you're having a busy day at work and you can sit somewhere with your headphones in at lunchtime. I've some of my non-believers like that one because it's only 3 minutes long, and they feel that's something they can manage and they really like. And then I've just put a couple of TED Talks. Love TED Talks. I'm a bit of a geek like that, but those two are really good. So Shauna Shapiro, she had a really sort of catastrophic spine injury when she was younger. So she talks about mindfulness from a perspective of having a really horrible, awful chronic condition, having to come to terms with a really difficult situation. And then that last one is another TED Talk where he talks about pain and happiness. And yeah, there are lots. So if you go and have a search, you will find absolutely tons of stuff, and it's really, really interesting. And you've never seen a stressed Buddha, so a Buddhist. So that's they know what they're talking about. This is, it's not, you may not be looking for enlightenment, but you can certainly get a lot out of practicing work in the present moment, and you'll notice an awful lot of things that you didn't notice before. For me, like I walk my dog, walking the dog used to be something I had to do before work or after work or before dinner. But now I'm in the moment on the walk, so I'm noticing the leaves and the tree, and I'm not even doing it on purpose anymore. You just find that you can be anywhere, and you just feel more content just to be where you are, even in traffic. There you go.
Brilliant. Really good. Sarah, that was superb. As I said at the beginning, this was the short version. So we're definitely going to try and get you back. Not sure which meeting, but I'll talk to you later about that. And I'll plan to come round, I think, to where you live with a recorder and get you to record some more of those sessions, because they were super. Apologies now, we've got to end. We've been going on for more than 2 hours, and I know one or two of us start to get very crossed legs. So, and that would interfere with mindfulness. So it's been a pleasure. I'll just double check, Kelly, any questions were in the chat that you saw at all? Is there any quick questions for Sarah? If you're there, Kelly.
Yeah, not that I can see in the chat, but my chat cut out halfway through, so there may be some others. So if anybody's got the questions and they want just quick questions for Sarah, put the hands up. I can come to you.
I just noticed Rosie said it was relaxing, but made her a little anxious to not distract herself from dizzy symptoms. Yeah, that's completely normal, and the thing is, we are focusing on something that we've been conditioned to find alarming. And you know, your body is used to finding your dizzy symptoms unpleasant, stressful, and alarming, and that's not going to be you know, a quick thing to change. If you wanted to explore it, I would encourage doing maybe some little bits, because the more you do, the more you relax and you just experience the symptoms without making any judgments about them. So you're not seeing them as bad or good. If I do a bigger talk one day, Kevin, what I was going to say is we need to be more like our dogs and cats and our pets, which is if your dog came back from the vets with a bad paw, yes, it experiences the bad paw, but what it's not doing, it's not attaching any meaning to it. It's not particularly alarmed. It's certainly not thinking, what if I can never go on a walk again? Obviously we have a different level of consciousness than our animals, but if we could be more animal in some ways, we can just experience things as they happen and try not to attach meaning. But it is easier said than done. So for Rosie, if you wanted to keep practicing, you might find that gets easier.
Lovely. Good. I think, folks, we're going to wrap up now for the day. Thanks ever so much, Sarah. It's been
welcome.
I know Cynthia's not with us now. She's hopefully back in bed recovering from COVID, but thanks also to Cynthia. Thanks to everyone who made the effort to attend today. It's really good to see such a good attendance. We will be back in a couple of months. Dates will be sent out, and who's going to be the guest speaker. You are going to see a lot more of Sarah. We're probably going to have to kidnap her at some stage, I fear, but she's so busy with the day job. But thanks ever so much. Thanks, Kelly, for being here today and helping. And all of you, try and practice a bit of mindfulness before we meet at the next meeting. Things will get better. Wherever you are, whatever stage with your condition, where if you're just on the beginning of your journey, in the middle, or maybe near the end, things do get better. Whether it's a mixture of better treatment or, as we've just been seeing, a better way to train that mind, life gets better. And remember, you've always got us. We're going nowhere. So thanks ever so much, everyone. Go and enjoy that weekend. Put a very warm coat on. Happy Father's Day tomorrow to dads. All have fun. See you again.
Thanks, Kevin. Bye, everyone.
Bye. Bye-bye.